Good evening, Los Angeles. This has been a big week. Let me start by thanking every Angelino. Whether you volunteered, donated, whether you just exercised your right to vote, no matter whether your candidate won or lost, your issue went through or not, thank you for being a part of the respect of democracy this past week. At the national level, clearly the people have spoken, and Joe Biden and Kamala Harris will be the next president and vice president of the United States of America. From my vantage point as your mayor, this is a great thing for Los Angeles. I got to know Joe Biden through my work as your mayor. When he was the vice president, when he was at the White House last, he came out here, not once, not twice, but a half dozen times, to help us do things like the heavy lift of raising our minimum wage and being the biggest city in America to lift people out of poverty. The way his wife, Dr. Jill Biden, soon to be our nation's First Lady, came out here to make college more accessible as we struggled successfully to make community college free and increased our public school attendance in community college by 50%. Around climate change, to win the Olympics, to do all of those things that we care about in Los Angeles. I know that Los Angeles loves Joe Biden, and Joe Biden loves Los Angeles. I was proud to support his campaign in a leadership position, not because of my relationship with him, but because of his relationship with our city and what he had done. And it was my way of saying thank you to him. Now, alongside him, our senator, Kamala Harris, who's had the good judgment to marry a great boy from Los Angeles and now lives here, we will have an Angelino in the White House alongside Joe Biden, an amazing and fierce advocate for justice, for opportunity, and for equity in our country. I congratulate both Joe Biden and Kamala Harris, and I can't wait to get to work with them here, helping our cities. Instead of seeing a White House go to war with our cities, we will have again friendship. I remember when Joe Biden was last in the White House. I was a recently elected mayor, and with my class of mayors in 2013, we came to the White House where he and Barack Obama didn't ask us for a photo op. They asked us for a conversation. And for 2 hours in the Roosevelt Room of the White House, they listened as mayors across this country said what they needed and what they needed from Washington. They asked us how they could help, and they delivered on things from immigration to making sure that we had economic opportunity, local jobs and transportation and infrastructure projects. And I look forward to Joe Biden being back in that White House. Our pride doesn't end there. We have all seen a week in which our democracy was tested. But we are resilient and we are strong. But lost in the excitement of this week and the election has been the dark clouds that continue to swirl around us. This is the toughest year of our lives, and we've been reminded of that by statistics that have shown us this is one of the most precious and dangerous and fragile moments in our fight against COVID-19. While everybody was hitting refresh on their browsers to check the numbers in the different states that were battleground states, you could have hit refresh on your browsers and seen each day the numbers go up when it comes to COVID-19. Just yesterday, the most Americans to ever get COVID-19 got it or were at least got their test results yesterday in our history of this fight. 10 million Americans now have been infected. 1 million in the last week. 1 million in the last 7 days. So the moment that we're out and celebrating the Lakers winning or the Dodgers winning or a change in the White House, we are brought back down to earth about how tough this year remains and our work that remains ahead of us. Overcoming our challenges is not for any one leader alone, whether it's in the White House or City Hall. It's the responsibility not just of any state or any party. It is the duty of every single American, of all of us. And the good news is, just as you showed your power at the ballot box, you have the power every single day to tame this threat, to make sure we bend this curve down, and that we get through this difficult moment just as we have before. In the words of President-elect Biden, this is the task of our time. In the midst of all of this, we know that this is tough. I know how tired you are. I know how long these days feel. I feel the same way. We have been in this crisis, my friends, for 243 days. This is the 74th time that I have addressed you in prime time to communicate the good and the bad news, the straight science and the facts, and the ways that you can help. Help your neighbor and your family, help those in need, and help us get through this moment. And now more than ever before, Los Angeles has been a national and a global example for how to get through this crisis. And I need you to continue that work here today. We need to summon that same spirit during this critical moment as cases and hospitalizations rise with alarming rates. Now, it isn't all bad news when it comes to this pandemic. Yesterday, we got some very welcome news when Pfizer announced that its vaccine candidate may be 90% effective. These are the most promising results we've seen thus far in any COVID vaccine trial. And as Dr. Bob Wachter, the chair of UC San Francisco Department of Medicine, wrote, 90% efficacy is far better than even the most optimistic projections. And Dr. Anthony Fauci called the results extraordinary. The trial shows that this vaccine may be very effective when it comes to preventing symptoms like fever and cough. What's still to be determined is how well it prevents more severe symptoms that lead to hospitalizations and death. And so in the coming weeks, we will be watching as scientists explore those questions, as well as issues of safety and side effects, and the FDA will eventually make a determination about the vaccine and other vaccines that are in development. But we can begin to see some light. And if this gets the green light from the FDA later this month, only a tiny fraction of Angelenos will get the vaccine at first. But I want you to know how hard we've been working behind the scenes with the state, with our federal partners, and with our county partners to be prepared to distribute this vaccine and make sure that Los Angeles, as we have led in so many other aspects of this pandemic, is ready. But in the meantime, we cannot let our guard down. We have so many more months ahead. If this is a baseball game, I feel confident saying we're past the halfway point, but we don't know how many innings or extra innings remain. We need to keep up our hard work. And when I walk through LA, I'm so proud to see Angelenos of all walks of life wearing a mask. This is the mask for the San Fernando Valley Veterans Day Parade that's tomorrow. I'm so proud when I see people physically distancing, waiting to get into a store or to pick up their food. The way that we've been allowed us to steer clear of becoming a hotspot like so many other parts of our country. While we had some good news this week, make no mistake, there are storm clouds that are brewing. This surge is not unique to LA. We're seeing things shut down in Europe. We're seeing mask mandates finally get to states that didn't have them in the United States. And LA continues, though, to have lower per capita cases and deaths than our peer cities across the country. That's your work. That's not just the work of City Hall or of County Public Health. That is your work. You own that. We need to work hard and continue to make smart decisions to avoid a lethal surge. You see, it's getting colder. People are spending more time indoors, in more dangerous spaces. And as we've been warned in the past, infections are beginning to rise and our hospitals are becoming more full. The data is truly concerning. Today in our county Public Health announced 2,318 more diagnosed positive infections, bringing our total to 325,876 Angelenos in our county who've experienced COVID. And 608 of those cases were here in the city of Los Angeles, bringing our total in the city to 133,594 cases. The county now estimates that, unfortunately, we've crossed the rate of transmission threshold above 1 again, from 0.95 to 1.02 last week. And our hospital inventory remains stable, even as there's more people in beds. Across the county, though, today there remain available 728 beds, 580 of them in acute care, and 148 in the ICUs. And we have 249 ICU patients who are severely sick, which is a substantial increase now since last month. And our thoughts go out to families awaiting good news out of those ICU units. The worst news is always the deaths that we have to announce. Today, the county announced 25 Angelenos gone, bringing our total now to 7,200 fallen. This makes COVID-19 the second leading cause of death in Los Angeles County this year, and we grieve with every family who now has a gaping hole at their dinner table, a gaping hole in their heart. And as you know, the state of California mandates that we track 6 different COVID-19 indicators, and unfortunately 5 out of 6 of those are now headed again in the wrong direction. This should be a bright, flashing light to all of us, to control our behavior, to not do stupid things. We know what works, and we know how to stop this. We must stop this increase right now. We remain in the orange on the threat indicator, and while we're not looking at going to red overnight, this next week or 2 will be crucial to determine what lies ahead and whether or not this increase is just temporary or a long-term trend. Fortunately, we understand so much more about COVID-19 than when we started. We know how it spreads, we know how to prevent it. Remember at the beginning when people didn't know whether masks worked? Remember at the beginning when people didn't know whether it was airborne? Remember at the beginning when we thought everything had to be shut down with a kind of cleaver instead of finding a scalpel to get us through this moment? We have learned so much. And as we know from public health experts here in Los Angeles and at the federal level, that the current dangerous spike in infections is being driven in part by gatherings, often between people who aren't showing symptoms. In fact, in the county's contact tracing, we are seeing that over 10% of people who have tested positive in the last week have been at a gathering with more than 10 people. That translates to 1 million people gathering with people outside their households. Those actions have made a patchwork of hotspots that could soon blanket our city. It needs to stop. Public health guidance is clear, and it will work when we act on it. And no one in our city or county is exempt from those rules. So I want to be very clear. If you're hosting gatherings in your house and attending parties that are more than what the rules permits, if you're acting like the virus doesn't exist, you may be spreading the virus. You may be taking people's lives. That's more death, more economic suffering, and more grief. I know it's painful, but we have to remember those scenes from New York, those hospital corridors in Italy, the other horrific scenes from cities at the worst moments in the past because they could soon be the worst moments of the present. The only thing standing between this city and the worst possible outcomes is us. Yesterday, the CDC updated guidance for Thanksgiving. We did a good job here around Halloween, and thank you. But now, CDC has urged all Americans to celebrate virtually or with members of your own household. Here in LA, county public health orders permit only small private gatherings of people from no more than 3 households held outdoors for 2 hours or less. This year, we should not be traveling to visit family in other cities or hosting family from out of town. We know that that is some of the spread coming in as people around the country get sick. While gatherings are one place of concern, though, county public health also tells us there's no one single cause. I get asked that question all the time. Mayor, what's the one place that we can shut down, or what's the one thing that people are doing? It's all of the above. It's coming from many sources, but in almost all cases, it's preventable. We know it works. Keep your mask on. Keep your distance. Keep washing your hands. Keep ensuring that your family gets a flu shot, and keep getting tested. If you think there's even a slight possibility that you've been exposed to the coronavirus, get a test at a community health center, through your health provider, or at one of the city, state, or county sites. Yesterday, Los Angeles reached a new milestone that I am proud of. 2 million COVID tests completed by the city of Los Angeles. That's 2/3 of the tests completed in the county. And we're preparing for the worst as we hope for the best. Nowhere is that better reflected than in our testing centers. And to help us attack this recent increase, I'm announcing tonight an expansion of the hours and an expansion of the capacity of our testing centers. Yesterday, we tested more people than we've tested in any single day, 18,958, nearly 19,000. But we're going to go further. At city sites this week, where we've had the capacity of about 20 to 24,000 tests, we're going to go up to 32,400 tests available each day to meet whatever demand comes. And we're extending hours at all of our testing sites from 8 to 2 to now 8 to 4. And at the biggest testing site, and what may be the biggest testing site in America, if not the world, Dodger Stadium, we're going to be open from 8 a.m. to 8 p.m. So take advantage of this testing regime that we've set up. The great volunteers and firefighters and others who are staffing it, our service workers, and I want to thank everybody who's ensuring that anybody who needs a test can get it, and anybody who has a test can use that information to stop the spread. Our 7-day positivity rate now stands at 6.8%. About 75% of the city's tests have been for unique patients, which now means a third of the city's residents have now been tested at one point or another. And we continue to send mobile testing teams around the city. Today, we have mobile testing teams at St. Elizabeth Church in Van Nuys, Food for Less on 103rd Street, and Liberty Temple Church in Arleta. And tomorrow, they'll be back at St. Elizabeth and at Liberty Temple Church, as well as the Marvin Browdy Center in Van Nuys, the government center. And this week, LA residents will receive a wireless emergency text, a message that alerts everyone with symptoms or possible exposure to get tested. It's going to go to everybody. It doesn't mean that you have symptoms. It's a reminder that if you do have symptoms or know somebody, please make sure you get tested. And we're going to follow up with resources, as we've done throughout this, for communities with the highest increases in infections, whether that's a geographic community, a cultural community, an age group. We now are smarter about how we do this, from our senior homes to ethnic communities, from our geography to our income levels, and we will make sure that those places that are seeing the highest risks, the highest increases, get the most resources. We still have appointments available for tests 7 days a week, so we encourage you to get tested or to find one of those more than 100 testing locations at coronavirus.lacity.org/testing. You can always, as well, call 311 if you don't have access to the internet. This has been a season of service and sacrifice, a time when each of us, our communities, and our nation have been tried and tested. We've kept people in their homes. We've assisted immigrants who were written out of bills at the federal level. And today, we've already given out $31 million in rental assistance to landlords and tenants, with another almost 70 million ready to go in these tough months. But nobody and no one, to me, embodies service and sacrifice like our city's veterans. I'm a proud veteran myself. I'm the grandson of a veteran who earned his citizenship as an immigrant to this country through his service in World War II, my grandfather Salvador. And here in Los Angeles, we have the highest concentration of veterans anywhere in the country. In fact, we've had more people pay the ultimate price, soldiers and airmen and women, the Marines and those sailors and Coast Guardsmen and women who have lost their lives in the recent wars of the past 2 decades here in Los Angeles. And we have more disabled veterans than anywhere as well. Let's make sure that this Veterans Day, that we remember them, that we lift them up in what's a tough year. Depression and suicide are up. Veterans who are coming home feel isolated. I established an Office of Veterans Affairs for the first time in Los Angeles when I became mayor, to provide jobs, over 12,000 of them so far, to house veterans experiencing homelessness, which is down 18% among veterans just since 2018 and nearly 2/3 since I became your mayor. We need to continue to remember that veterans are those who put on a uniform to save our liberties and our freedoms, who sacrificed and still are paying the price quite often for the trauma that they carry. So while everything else looks different this year, I hope Veterans Day will remain the same in this way. Our allegiance to this nation, which is tested and tried. This week we feel that. This year we know that. But those veterans and the men and women of our armed forces are always there, not asking about political parties or division, not shirking away from a challenge, whether it's foreign or domestic, but standing up to embody the very best of this country. Tonight, Americans will sleep soundly because of you, LA veterans, because of your sacrifice. We honor you, we recognize you, and we see you. And as we continue to confront the daunting challenges that we face, let us draw on that spirit. Let us recognize the power that we have to change the course through an election, through a mask, through service of this country. Let us be the writers of this new and brave chapter so that we can end this dark one with the strength and with the hope that this city embodies. We are strong and we are resilient, and we will continue to march forward together Thank you for everything you are doing, and hang in there, Los Angeles. We're going to get through this, and we're going to get through it together. Sending you, as always, strength and love. I'm going to now speak in Spanish, and then I'll take questions after that. Muy buenas tardes, Los Ángeles. Las voces de nuestro pueblo han votado para elegir a Joe Biden y a Kamala Harris como nuestro próximo presidente y próximo vicepresidente de los Estados Unidos. Joe Biden es un gran hombre con integridad, con experiencia y un gran amigo de Los Ángeles, quien apoyó el aumento de nuestro salario mínimo y el esfuerzo para traer los Juegos Olímpicos a nuestra ciudad. Fue un honor ser vicepresidente de su campaña. Él tiene una visión para restaurar el alma de nuestro país, derrotar la pandemia de COVID-19 y empezar a construir nuestra economía mejor. Y todos tendremos una parte en este trabajo, especialmente en nuestra lucha contra la pandemia. Y felicidades a una angelina, Kamala Harris, la hija de 2 inmigrantes, nuestra senadora y una representación de nuestra visión aquí en este estado, de un país donde toda la gente pertenece. En nuestra lucha contra la pandemia, gracias a sus esfuerzos en usar una mascarilla, logramos evitar un gran brote aquí, como han tenido en otras partes del país. Pero con el clima frío y con más gente actuando como si el virus se ha desaparecido, ahora vemos que el número de casos está subiendo y nuestros hospitales se están llenando. Sin embargo, recibimos buenas noticias ayer con los resultados de los estudios en Pfizer, indicando que su vacuna puede ser efectiva en 90% del tiempo. Sin embargo, quedan muchas preguntas sobre cómo funciona esta vacuna. Aun si es aprobada por la FDA, tomará meses para distribuirla a la mayoría de angelinos. Y por eso tenemos que seguir tomando las precauciones para cuidarnos y cuidar a nuestras familias y comunidades. A partir de hoy, los 6 indicadores que monitoreamos en Los Ángeles están subiendo, una señal muy preocupante. Hoy en nuestro condado tuvimos 2,318 nuevas infecciones. En total, 325,876. Entre ellos, 608 están en la ciudad de Los Ángeles. En total hemos tenido 133,594 casos en la ciudad. Además, nuestra tasa de transmisión subió a 1.02 en la última semana. Y en los hospitales del condado hay 728 camas disponibles. El condado también reportó 25 fallecidos. En total, en el condado de Los Ángeles, hemos perdido 7,200 angelinos. COVID-19 es la segunda causa de muerte en el condado de Los Ángeles este año. Afortunadamente, entendemos mucho más sobre este virus que antes, y sabemos cómo se propaga y cómo prevenirlo. Y sabemos que el gran aumento de infecciones es a causa de las reuniones, frecuentemente entre personas que no muestran síntomas. De hecho, el 10% de personas positivas en el condado habían estado en una reunión con más de 10 personas en la semana anterior. Estas reuniones están causando pequeños brotes que pronto se pueden extender por toda la ciudad. Así que quiero ser muy claro. Si está organizando reuniones en su casa, si está asistiendo a fiestas, si está actuando como si este virus no existe, usted es responsable por este brote. Sus acciones causan más enfermedades, más muertes, más sufrimiento económico y más dolor. Este es el peor momento para olvidar las precauciones. Todos debemos hacer nuestra parte para controlar el brote y evitar lo peor. Use una mascarilla, mantenga su distancia y lávese las manos. Y por favor, vacúnese contra la gripe si ya no lo ha hecho. Para el Día de Acción de Gracias este año, celebre virtualmente o con miembros de su propio hogar. No debemos de viajar ni alojar a familiares de otra ciudad. Y si cree que ha sido expuesto al coronavirus, hágase la prueba. Ayer Los Ángeles alcanzó un hito: 2 millones de pruebas de COVID-19 realizadas por nuestra ciudad. Tengo mucho orgullo de los voluntarios, los bomberos y estos sitios que han producido estos resultados. Estamos preparando por lo peor mientras esperamos lo mejor. Y esto lo refleja nuestros sitios de prueba. Hoy estoy anunciando que estamos ampliando nuestra capacidad de pruebas con expandir el horario de 8 de la mañana hasta los 8 de la noche en nuestro sitio de Dodger Stadium. Los otros sitios también expandirá al horario de 8 de la mañana a las 4 de la tarde. En los sitios de la ciudad esta semana tenemos la capacidad para realizar 32,400 pruebas cada día, un nuevo récord. También seguimos enviando equipos móviles por todos Los Ángeles. Mañana estarán en la iglesia St. Elizabeth y la iglesia Liberty Temple, así como en el centro de Marvin Browdy en Van Nuys, el centro de gobierno. Además, esta semana, residentes de Los Ángeles recibirán un texto instando a que se hagan la prueba si tienen síntomas o si piensan que han sido expuestos. Tenemos varias citas abiertas. Para hacer una cita, visita coronavirus.lacity.org/testing o llama a 311. Esta ha sido una temporada de servicio y sacrificio. Un tiempo muy difícil para cada uno de nosotros y para nuestras comunidades y nuestra nación. Pero angelinos han hecho lo posible para apoyar a nuestros vecinos y proteger a lo más importante. Nadie representa este espíritu como los veteranos de nuestra ciudad. Yo soy un nieto de un veterano, un inmigrante de México que recibió su ciudadanía como el resultado de su servicio en la Segunda Guerra Mundial. Y yo soy un veterano también. Y aunque el Día de los Veteranos será diferente mañana, una cosa nunca cambia: nuestro agradecimiento por todos quienes se presentaron para proteger y defender a los Estados Unidos. Honramos sus sacrificios con asegurar que tengan un hogar, un empleo y un salario, y un futuro con oportunidad. Mientras seguimos enfrentando nuestros desafíos, seguiremos el ejemplo del espíritu de nuestros veteranos. Sigamos adelante juntos. Quédense protegidos, quédense en buena salud y si pueden, quédense en casa. Fuerza y amor, Los Ángeles. And with that, happy to answer questions. Thank you.
Thank you. And our first question comes from Ben Oreskes from the LA Times. Please go ahead.
Hey, Ben.
Hey, Mayor. How are you? Thanks for doing
Hey,
this.
you bet.
Question for you about would you support using the convention center to house homeless people? We've seen this be done in San Diego and other places,
Yeah.
and the City Council today asked for the feasibility of this to be studied.
I'm absolutely behind the feasibility of it and very open to that. Right now, we have capacity in our shelters, and I was just speaking with the head of LASA about what we can do to continue to fill those beds. Part of it may be the distance that those beds have to be. So some of those might be empty because public health during this pandemic has said 6 feet, and some of them are closer, like 3 feet to each other. I want to make sure that we fill that capacity that we have. But absolutely, we've seen more success with the hotel, motel rooms, and permanent placements. And so I wouldn't want anything to come at the expense of that. But I've always been an all of the above kind of guy, that we need shelter that's overnight, we need shelter that's more medium term, and then we need those housing solutions that are long term. So I'm absolutely open to that. I look forward to seeing that, and I think it bears studying. I've looked at what they've done in other cities, and it can be quite effective, and we aren't using it. So why not put that asset to work? Thank you. Next question. Do we have any more questions?
Next question, please.
Thank you, and that comes from the line of Leslie Duarte from KNBC.
Hey, Leslie, how you doing?
Hi, hello, Mayor Garcetti. Thank you for taking our questions today. If it's okay, can I please ask you 2 questions?
Yeah, please, go ahead.
Thank you. So my first question is, there's a proposal to turn LA Convention Center into a temporary homeless shelter. How do you feel about it, and where would the supplies to furnish it come from?
Why don't you ask me the second one, because you might have been in the queue. I just answered that with a previous reporter, but go ahead, ask the second one, and I'll say a couple more words.
Apologize.
Oh, no, don't worry.
Sorry about that.
I know it's the system.
My second question is regarding the rapid testing. Any word on how soon that could roll out on any or all testing sites?
Sure. So let me start with the rapid testing. So it's basically about a 6-week pilot that will initially see the initial results. It started now, I believe it's 2.5 weeks ago, maybe 3. I'll have to double check. So in a few weeks, we'll know some of the initial results working with USC. There's a couple factors at play. One is how many tests we can get. And the state of California is getting millions of those tests, so we're working with them to try to see if we can distribute those in coming months. It wouldn't be, in November, but I think by the beginning of the year, we could start doing that. Second, we want to start testing this in school environment and with children. So at our testing sites, we are going to be doing that. I think that begins in a week or so that we can get some data about what it means for our youth and compare these rapid tests that are less sensitive but much cheaper with the very expensive and more sensitive PCR tests. And if we see a good overlap there, then I think we'll be able to say, why don't we pour some money into this? We get much of that money reimbursed from the federal government, as you know, from testing, and let's move forward at the beginning of the year. So that's, to me, kind of the deadline. Let's research during this year, see if we can nail that down and be one of the first cities to be able to roll that out should that need still exist, and I think it will. In terms of the convention center, I said, we have to look at the cost, we have to look at feasibility, we have to make sure that existing beds and shelters that are empty right now get filled, and we have to also find out if certain people aren't going into congregate shelter settings anymore, which some outreach workers are saying it's more and more difficult, that people have seen, and it's quite frankly been more effective oftentimes to have people in a hotel or motel room where they can kind of get their life together, be case managed, and then move on to permanent housing. I am open to any of those solutions. I think it merits studying. I'd like that report to be turned around quickly and together with the City Council to make an informed decision. But the more beds, the better in general, and the more quickly we can get them, as long as it doesn't come at the expense of making sure we get those long-term solutions. Thanks. Next question, please.
Thank you, and that comes from Robert Koviasek from NBC. Please
Hey, Robert.
Mayor Garcetti, how are you?
I'm good.
Let's talk briefly about how you perceive the timeline working here in California once a vaccine is approved, understanding that Governor Newsom is going to have a separate review of anything the FDA approves. And how do you think that could potentially delay the vaccine getting out here to Southern California?
Well, I would hope it would not, and I have a lot of trust in Dr. Galley and in our governor, who's been able to move oftentimes much more quickly than Washington, but this would have to come either simultaneously or just after. We are preparing for the distribution side of things, so the county and the state are working together on that, and as we know, that is a real federal undertaking that retired and current military folks are overseeing, and I have a lot of faith in I've been in the military. I know you tell people the mission, you tell it's moving tomorrow, and as the general said today, you tell us with green light we could start moving in 24 hours. We want to make sure these are safe vaccines, though. I know it's compelling. I know it's very enticing. You hear 90% the time that it works. We need to still have a little bit more information, so I do welcome the state having a second look at that, but I hope that that won't delay us at all. Last piece is there's a working group here in the county, and we intend to help with all sorts of logistical things. For instance, we talked today about whether our testing centers, places like Dodger Stadium, could be stood up as places to get vaccine, especially for folks who can't get them from a medical provider or want to do it quickly. We need to think about if it's the Pfizer vaccine, it has to be done twice and it has to be kept extremely cold. But lo and behold, downtown here, we have amazing warehouses for cold storage where people are experienced with this, and maybe we can enlist them so that we could have that key command. And we will offer ourselves at the national level, as we have done with asymptomatic testing, as we have done to bring down African American deaths, as we have done with masks, to be the first in line. We have been, I think, in LA, unafraid to test things first. This is a vaccine, though, so we want to be careful. But as long as it's a logistical question, I think we have all the capacity here to be at the very front of the line, and I don't think that California will slow us up. Thank you, Robert. And with that, that's the last question. Thank you all very much. Have a good night, behave well, and we'll see you soon. Thanks.